Hello, everyone. My name is Gregory Bolden. I'm the Community Initiatives Program Manager at the Center for Black Health and Equity. And today I'd like to welcome you to our No Menthol Sunday Retailer Engagement Training. This is our 9th year for the No Menthol Sunday activities, and it began as an initiative to reach out to build awareness and to engage faith communities across the nation around the use and the scourge of menthol in the Black community. This has taken place, like I said, over the last 9 years, and over the last few years, a few of our partners have expanded to include retail outlets, and they've been very effective in their outreach. And so in expanding that outreach to those outlets, Jump at the Sun, which is one of our primary partners with No Menthol Sunday, led by their president, Lorraine Latham, with the help of Michael Danham and Edgar Mendez, are going to be our trainers and facilitators for today. And they're going to show us how they've used their effective tools to outreach to retail outlets. As a final note, this training will be recorded and will be shared at a later date, and we'll actually have it available for you soon so that you can use not only for No Menthol Sunday, but throughout the year. So without further ado, I'd like to turn it over to Lorraine Latham, the president of Jump at the Sun, for the training that's taking place at this time.
Thank you, Greg. And good afternoon, everyone. My name again is Lorraine Latham, president of Jump at the Sun Consultants. And today we're going to be talking about retailers as tobacco prevention allies. Next slide, please. Just briefly speaking, our mission is to improve the health and well-being and address disparities in low-income communities. And we have a vision of a world of hope, tolerance, and social justice where everyone lives in dignity and has an equal opportunity to achieve optimal health. Next slide. We're using this opportunity to provide you with an overview of the work that we've done with our retailers to create an opportunity for discussion, and then hopefully you'll be able to integrate some of our lessons learned into the work that you're doing. Next slide. I'm going to turn it over to Edgar Mendez, who's going to get us started.
Hi, everyone. Thank you for joining us today. My name is Edgar Mendez, and I'm a communications director for Jump at the Sun. And before I talk about the tobacco retail environment in Milwaukee, I want to tell you a little bit about Milwaukee. Well, it's a city of about 600,000 located along Lake Michigan. The latest census data showed that the population in the city was 39% Black, 39% white, 20% Latinx, with other groups making up the rest of the total. In addition, about 24% of residents live in poverty, with those rates increasing for African Americans. Another thing I will say about Milwaukee as a whole is that the city is known for its extreme segregation, which will be reflected in a map I show you shortly. In terms of what the tobacco retail environment in Milwaukee is like, well, this is a question we sought to examine in depth beginning in 2016 with the pilot project. The Milwaukee Retailer Assessment Project utilized the STARS assessment tool to look at specific issues such as the amount of outdoor tobacco advertising, the types of products that were being advertised in certain communities, price promotions, and more specific issues such as whether tobacco products were being placed near candy or within 3 feet of the floor, which would be considered eye level for children. The pilot went statewide for the next few years, but I'll focus on the findings for Milwaukee. Next slide, please. Okay, great. So if you look at this map, you'll see a visual example of the extreme segregation I mentioned earlier. The clusters, you'll see cluster A, that's African-American neighborhoods located primarily on the north side of the city. Clusters B, that's the Hispanic enclave in the city. And cluster C is the surrounding area that is primarily white. So what did we find when we looked at these clusters? We found out that tobacco retailer density, which is the amount of retailers per 1,000 residents, was 4 times higher in cluster A than cluster C. We also learned that it was 3 times more likely for a tobacco retailer to be located near a school in cluster A and B than cluster C. Why are both of these findings significant? Well, studies show that higher retail density is associated with higher youth initiation rates, more impulse buys, and a harder time quitting using tobacco. What else did we learn? Well, we learned that flavored tobacco, namely menthol, was advertised more in Black and brown communities, that there were more price promotions offered in those communities for menthols, and there was more access to flavored cigars for less than $1 in those communities. What did we learn about the suburbs? We learned that e-cigarettes were more likely to be sold and advertised there. I'll now pass it back to Lorraine for our next slide. You're muted, Lorraine.
Sorry. To help frame our discussion, the best practices that we learned over time was that we need to start embracing our tobacco retailers not as enemies, but as a very important part of our partners in the tobacco movement. And also we have to provide them with support. We have to educate them and provide them with assistance. And then dialogue, engage in non-judgmental conversation on a regular basis with our retailers. Next slide. This is our story. It starts with this little sign, no singles. We started seeing these signs pop up all over the city. And it was retailers that were writing the handwritten signs to alert their customers to the fact that it's against the law to sell single cigarettes known as loosies. And so basically these were retailers that were doing the right thing, and they were tired of getting into confrontations with their customers around this issue. The picture below are the business owners, retailers that came together, and we worked as a group to develop a campaign, a No Singles, No Loosies campaign. So that's how we started working with our retailers. Next slide. Embedded in our collaborations with retailers is our pursuit for social justice and health equity. We know that tobacco is not an equal opportunity killer. We know the industry uses flavors to entice youth, and we see the collision between tobacco enforcement, law enforcement, and loss of life. Examples of that, clearly George Floyd, Eric Garner, Sandra Bland, and the list goes on. The one thing sometimes I don't think we always realize is that the tobacco retailers also encounter predatory practices by the tobacco industry. They're hounded, they're enticed with contracts to give them prime product placement. We see our retailers have shared with us that their wholesalers will come in on a weekly basis just to monitor the placement of their products. Next slide. So today we're going to share 6 best practices or promising practices, and I think they're going to pop up. Edgar will go through the first 3 practices, and then I'll give an overview of the last 6 or the last 3 practices. So with that said, I'm going to turn it over to Edgar.
Great, thank you, Lorraine. So if you look here, these are, sorry, one second. If you look here, these are members of Hepatha Church's Holy Ground Core Team, and they entered into a community agreement with Syngas. So a little background on that is Syngas, which is located near Hepatha Church, had become a problem in the community. It was a place where people sold single cigarettes and worse things outside, and a place where violence occurred regularly. It was a nuisance. So now in the city of Milwaukee, we have a municipal ordinance on the books for nuisance properties that includes businesses. So if there is a certain number of calls to police and resident complaints, they will be shut down. So rather than go that approach, this team approached the owner of Syngas with an idea of a community agreement. Essentially, it was an agreement between the owner and the community to clean up his store by improving lighting, keeping the area clean, not selling tobacco to minors, and regularly attending community meetings, among other stipulations. Now, if this agreement was broken, the owners of Syngas agreed to give up their license. Next slide, please. So if you look on top, that's the definition of a community agreement by group. But if you look on the side, you'll see some of the strategies you can use to create these. So as it relates to rules versus norms, rules let people know what to do and what not to do in specific situations. Norms are behaviors expected of people when interacting with other members of society. So what this group did was turn the rules for syngas into the norm. Relational versus operational agreements. The group approached syngas from an area of respect. So here are our problems, and we'd also like to talk to you about yours. Together, they built that relationship by helping each other address each other's problems. Once they had that relationship, they were able to make an operational agreement that would do things that prevented kids from crossing the busy street during recess, stop the sale of single cigarettes, and prevent tobacco from being sold to minors by improving surveillance around the store and better training employees. Why are community agreements important? Well, in this case, it got to the point where the agreement did not need to be renewed anymore because it became mutual, with store owners attending community meetings, and in turn, they were able to continue doing business in a positive manner. We can go on to the next slide. So this is another one of the practices that we've been utilizing over the years. It was really successful. Obviously, with the pandemic slowed down, but we're getting back to it now. But what is a tobacco retailer tour? Well, it's exactly what it sounds like. It's a visit that we organize that includes residents and network members to a local retailer, a corner store, a gas station, and it serves multiple functions. One, it gives residents and other people in the movement a chance to learn more about the tobacco retail environment firsthand, not just by visiting the store, but by hearing from the owner and asking questions. Also, it gives retailers a chance to show off their store. They talk about how long they've been in business, some of the products they sell, and they'll talk about their work in support of the community. It also gives them a chance to demonstrate their knowledge of tobacco prevention. They talk about conversations they have with customers about quitting tobacco, about why they don't place tobacco near candy, the T21 law, and No Menthol Sunday. They're really proud to show off that knowledge. So we can go to video, Michael. This is Jack. He's been a big supporter. We're here today for a tobacco retailer tour. So welcome everyone, come on in. Thanks, Michael. So this is another best practice that we've focused on over the years, and it's the inclusion of retailers in social and traditional media campaigns. So if you look here are some examples of the earned media that we've gotten through our retailer campaigns. So we can go to the next slide, Michael.
My name is Ebony. Gauss has been here for 55 years and more. It's a family business. Yes, we had problems with minors trying to purchase tobacco here, but we also know the law is so we're not allowed to sell minors tobacco. We got involved in the No Lucy's, No Singles campaign to let our customers know it is illegal to buy single cigarettes. The advice for customers that smoke is to try to quit smoking because it's not good for you and you can save plenty of money.
Thank you. So that was Ebony, and that campaign that she was talking about involved a press conference with speeches by retailers, news interviews, ads taken out in community newspapers, listing and thanking each participating store. It also included social media and other outreach strategies that helped us amplify this campaign in the community. Now, yes, this involved more work on our end because we didn't just ask retailers to jump in front of the camera, we prepped them. We provided talking points, did mock interviews, we included their quotes in news releases. We provided whatever kind of support they felt they needed. And for those who weren't comfortable on camera, well, they got to stand to the side and still be on the news. We follow a similar model for No Menthol Sunday and other campaigns. It's a great way for retailers to highlight their business and the fact that they are partners of the community. So if you look at that image, there's a bunch of other media that we've gotten. So thank you.
Thank you, Edgar. And related to that, another best practice is to provide public recognition of our retailers. We know that that's a big motivator. So at our quarterly meetings, we recognize our retailers. We also recognize them in their own place of business. It's not a lot to say thank you for partnering with us. It does not take a lot to do that, but it goes a long way. So this is just examples where we're presenting them with certificates acknowledging our partnership with them. Next slide. Also, again, related to public recognition, at the press conference, we had a poster that listed every single store, retailer that participated in our No Singles, No Loosies campaign with their addresses. So then the buzz is around the community, and they're wearing the t-shirts in terms of that's the place you want to go in terms of the corner store or gas station. They're doing the right thing for our community. Next slide. Again, Edgar talked about allowing them to be interviewed. For Black History Month, we took out a full-page ad, again, listing all of the retailers. We thought it was pretty historic that they participated in No Menthol Sunday, and we wanted to recognize them. Next slide. So how do you sustain relationships during troubled times? And we certainly went through some troubled times in terms of Jacob Blake and other civil unrest that was going on at the time, the COVID pandemic. Some of the things that we did with the help of our state tobacco prevention and control program, is that we helped to continue to educate our retailers. So we provided them with a fact sheet on how do you check for IDs during COVID with face masks. That's the one in the center that was developed. And then we were frank, we talked about tobacco, COVID, and racism. These are all products that were produced as part of it was produced by our state tobacco prevention and control program. We did mailings when we couldn't get out. We sent face masks that they could use for their customers as well as their employees. We took signage out as well. So again, we still tried to remain very interactive with our retailers during the pandemic. Next slide. Again, talking about sustaining relationships, you can see here, when COVID hit, we didn't know if our retailers would continue to not sell tobacco products on No Menthol Sunday. They were losing revenue. And so we didn't know if they would stick with us, but they did. This is from the No Menthol Sunday 2020. You can see in the window, there's a sign that was hanging up. The signs go up at least a week before No Menthol Sunday so that they alert their customers. On this day, when you visit us, you will not be able to buy menthols. We'll give you information. We will give you palm cards and information if you're interested in quitting, but we are not going to be selling menthols on that particular date. And I believe there's a video here, Michael.
We're not the first black-owned gas station. When we got into this, it was many black-owned gas stations. We may be the last one that's still around as a black owner, but we're not the first.
Well, people come in and sponsor us, and they come and they pick this store, and they would like to sponsor us, and it has been a great blessing to the community, and it draws lots of people.
That is always a good feeling to be able to give back. I have a sister right now who's struggling with trying to quit smoking, and it is a real struggle. She's been smoking for, I'm gonna say at least 40 plus years, and she wants to quit, but it is a struggle for her to quit. So she's... But that's just it, to improve the health of the people in the community. You know, we want to have long, healthy lives without the deterioration of our body. You see those commercials on TV, which is, I mean, they're awful, you know, where the voice box is gone, you have to have this trach and things of that nature. And I know strokes are high risk, because my sister did have a stroke, and high blood pressure, all of that is part of that. So with the menthol, is it true that really they're trying to push the poshes, the liquid menthol stuff? They want to get rid of the tobacco, push the liquid stuff. Is that true, or is that going to be any healthier? I can't see that. I can't see that being any healthier.
So thank you, Michael. So that was Diane, and she actually helped us to develop the No Singles, No Loosies, and they've participated in No Menthol Sunday since we started the program. She was describing when gas went crazy high that they were able to give out gas, actually $50. They would fill the tanks for $50. So that's one example during troubled times, how you can give back. We have a great relationship with our tobacco prevention and control program. They did allow us to provide gas vouchers during the pandemic as well. So I think that is, and next slide. This is the same thing. We can pass. There was a video. And then finally, really working with our retailers, we provided, after No Menthol Sunday, we provided mini grants to our retailers so that they could still do community outreach. This is Sam, he's the retailer here. Example, he had an event where he gave out t-shirts, and then there was still lots of information from No Menthol Sunday that was given out, information on promoting our 1-800-QUIT line and other places where you can get support to quit. So we provided them with a mini grant, a No Menthol Sunday mini grant. And if you want to play that video, Michael.
My name is Sam Singh. I'm the owner on the Lucky Sam Food Mart. I'm always helpful anybody, and he always support me like family. The most popular tobacco product is Newport, so people most like the Newport. No, we don't have any problem with that, because we always asking ID first, so before purchase anything, anybody. I remember that when it's going on, and we gave away the gift and T-shirts and the other stuff, and for educated the people to how to stay away from menthol. My advice is when you be partner of this, and you're gonna learn a lot, and also you help the community, and community gonna help you also. When you help the community, is always supporting you, and you also teach that this young generation how to live the life and how to be stay away from this tobacco product.
All right, so that was a message from Sam, who was talking about No Menthol Sunday and the involvement in his store. Someone in the chat also asked us how are retailers participating in No Menthol Sunday. So I'll cover a couple of different ways that we've been using the tools of No Menthol Sunday to engage retailers in tobacco prevention education, and then also just kind of share some suggestions with you about how you can utilize No Menthol Sunday as an opportunity for you to open up the door and just share some best practices about, what it looks like to develop those types of relationships with retailers. As you can see in the pictures that we have here, there are a number of posters that we produced from last year's campaign that we were able to walk into the store to the retailers and ask them if they will put them up in honor of No Menthol Sunday. Along with that, we also talked to them about No Menthol Sunday to let them know what the purpose and the objective of that day is and ask them for their participation. Their participation can look different in a lot of different ways. Sometimes it could be as simple as putting up the poster. We have some who commit to putting up the poster, taking palm cards that they sit out on their counter, and then also they will not sell menthol tobacco products on No Menthol Sunday. The poster is good because it allows them to put it up ahead of time, which lets people walking into the store know that the day is coming. The palm cards are good because if someone asks, why aren't you selling menthol products today? They can hand them the palm cards with some more educational information about the campaign and the harm of menthol in the Black community. And then also like having the additional resources that we provide. Sometimes we have t-shirts, we have brochures. So it opens the door for the retailers to have conversations with the clients who are coming in, just to open that door and to get them involved. And we've been able to do that over the years. But it initially just started with, having the initial approach to just talk to them about the campaign. So No Menthol Sunday was a great way to open that door. You'll also see that we have an ad. Lorraine talked about this earlier. One of the things that we do is we take any opportunity we can to recognize the retailers and to thank them for their participation and their support. So we've taken out full page ads in the local newspapers listing their location, saying that they're being recognized because they supported No Menthol Sunday and they support our tobacco prevention objectives. We also have, when we do our annual No Menthol Sunday kickoff, last year we had our lieutenant governor from the state of Wisconsin who thanked retailers for participating and supporting No Menthol Sunday. So support looks a lot of different ways, but if you are looking for an opportunity to walk in the door and start that conversation, No Menthol Sunday is a great chance to do that. The tools are there. So we have a couple of discussion questions that I'll just pull up on the screen to kind of get you to start thinking about how your agency has interacted or collaborated with retailers in the past in a positive manner. And then also want to give you something to think about when it comes to best practice. Like, did you see anything that we shared today that you'd be able to implement? Are there possible facilitators, barriers, or people within your organization who can help open the door? For us, it was, you saw in the first example from Edgar Hepatha Church, they had an issue that they wanted to address in the community, which then allowed us to come to the table in partnership with them and open that door for a conversation. So these are just a couple of points that we want you to take in consideration. How you can use No Menthol Sunday, how you can duplicate some of the processes that we've shared in some of our best practices. I will leave you with this. When you're working with retailers, we found this quote that we thought to be pretty reflective of the process that we went through. Coming together is a beginning, staying together is a progress, and working together is success. So our relationship with retailers had taken place over an extended period of time. We didn't walk in the door right away making a request or an ask of them to stop selling menthol products. We really took time to get to know them, build relationships with them, educate them about what we were doing. And, we were found that many of them appreciated that. Many of them had their own negative experiences with the tobacco industry, and they welcomed us into the door. So we just want to close with just sharing some acknowledgements about people who have supported us. The Center for Black Health and Equity has always been a partner with this, and anytime we come make some requests and tell them the ideas that we have, they've been very supportive of that. We have our local partners and the retailers that have worked with us, and our community partners, the churches that work with us. No Menthol Sunday allowed us to open those doors as well to build those relationships with them. So every year we see our footprint when it comes to this work growing because of that. So Lorraine, I'll turn it over to you for closing.
Okay, there's questions in the chat. I don't know how much time, do we have time for discussion, or are we at the hour?
We have 30 more minutes.
Yes.
Yay!
Yeah,
Yay,
lots.
that's how we planned it. We wanted to have some discussion. So Michael did raise some issues. Anyone can come off mute if you'd like to chime in on the discussion, and then
There's also some in the chat already, Lorraine. There's
okay,
some questions.
okay.
Yeah, if you like, I can read some of them out.
Yes, can you do that?
Okay. So can you share some examples of community agreements that were made between the community and retailers?
Okay, I can speak on it, and Edgar, you can chime in. So with the Hebetha example, they were concerned. Sing gas station actually has 2 gas stations, and they were troubled properties because there was drugs and illegal activities that were going on. And so Hebetha basically said, we're not going to let you do business here anymore until we can agree on how you're going to do business. So it's actually a written document. We had our alderperson also signed off on it. Magic Food was another business that was part of the Hebetha community agreement. So we can easily share with this group sample examples of what a community agreement looks like, but it's really just how are we going to do business? How are you going to do business in our community in a way that's respectful to our community? They were concerned about kids crossing the street at lunchtime, running across busy streets just to buy candy. So they agreed, okay, we're not going to sell candy during these hours. They were concerned about marijuana being sold and about those singles and whatever. But it took some time, and it was in play. And part of the agreement was you have to attend a monthly meeting and be held accountable on a monthly basis. So they would come to the monthly meetings, and we, the African American Tobacco Prevention Network, would attend those meetings. And we were able to say, were they in compliance when we do our checks, our Wisconsin Wins checks? Did they sell to a minor or whatever? So that happened for, I don't know, maybe 2 years, 3 years, and then they didn't need those agreements anymore. Edgar, did I miss anything on that?
No, I just wanted to say that there are some national guidelines, or the National Equity Project has some good frameworks, and obviously as Lorraine mentioned, every agreement will look different depending on the needs of your community. And I did also want to mention that I was on the latest meeting, and the retailers were on there, and it's ongoing. So the retailers were talking about they were having problems with young people going in the stores and grab and goes, and we were kind of brainstorming about what we could do. Should we go to the schools and talk to the kids and the parents, things we could do together to help solve their problems as well.
Fantastic. How widely used is this kind of engagement? And what lessons from this fantastic presentations can be used in a legislative menthol campaign?
I'll start. Edgar, please add on. I don't know. I ask this question all the time. Are we the only ones working with retailers in this way? We even did a lit review to try to see, are other people working with retailers in this way? And we haven't seen it yet. In terms of any type of legislative, when we do legislative visits, I think what works well is when we share this information. Retailers are small businesses. They want to be able to make a profit. They all are also mothers, fathers, and they want good for their kids and the community. So we kind of share those stories with elected officials to not think that for them to just automatically feel as if they're going to be receive pushback from retailers, because there are retailers that are doing the right thing. We gave you some examples here. I don't know, is there anything else you can think of, Edgar or Michael?
I can think of, I know that in our newsletters and in our communications that go out when we highlight our retailers for doing the right things, those are communications that our elected officials look at regularly. So that way they know that we're working with retailers and that we do have allies in tobacco prevention movement in the retailer. So I think it makes the argument a lot stronger for supporting legislation related to tobacco.
Reading our newsletters, we invite them to our meetings. We invite them to our No Menthol Sunday kickoff. We invite them to the community events that our churches do for No Menthol Sunday. So all of these are opportunities for us to invite legislators into the process so that they can be involved as these things are developing. So that would be another suggestion. If you are hosting public meetings, invite them to them. We've been surprised over the years that they come regularly, many of them, and they read the stuff that we put out and thank us for sharing it with them.
And we actually invite them to our No Menthol Sunday events in terms of the churches that are involved. So they appear there and they're able to hear from our pastors as well.
Yeah. Here's another good one. How can academic researchers become involved in No Menthol Sunday? So I'll probably have to lead that one because I'm currently involved in working with one of our partners now at the University of Wisconsin Center for Tobacco Research. And they are working with us because they have relationships with the healthcare community in the state. And they have people who go out to I believe they're going out to the hospitals. Is that correct? All right.
Mhm.
That they're going out to speak to them. And one of the things that they agreed to do this year for for No Menthol Sunday was take like a one-pager that the physicians and the nurses can actually hand out to patients to let patients know about No Menthol Sunday and use it as an educational tool just to inform the patients about the harms of menthol and what it's doing in the community. So that's one way that they've been involved. They are using their resources and their information and the data from the research that they have to modify something that we already created for churches to educate them. And they agreed to follow that model and use that in that way. Did anyone else have anything to add to that?
I do. Also, again, it's they've participated during No Menthol Sunday, and anyone who knows Wisconsin, for us, No Menthol Sunday is the entire week, the week of. So they have appeared on talk radio with us. So they're able to provide the science and the kind of the information from a very scientific standpoint around tobacco. So they've appeared on radio with us, and we're actually trying to do more in terms of evaluation of not only No Menthol Sunday, but definitely we put a lot into No Menthol Sunday. So they're involved in helping us to evaluate the impact and the reach of No Menthol Sunday. Just there's small things that they can do to help you in terms of developing surveys that you might want to do. Go to pursue funding. We partner with them to pursue funding to help expand the resources that we have for all of our tobacco education outreach, including No Menthol Sunday.
And how has that played out with retailers if they have sold to youth? That will speak to our Wisconsin Wins efforts, I believe.
Mm-hmm. Edgar, you want to talk about Wisconsin Wins? We have enforcement.
Sure. So, the Wisconsin Wins program, it's a program where we have young people 15 to 17 years old go into tobacco retail stores and attempt to purchase of tobacco. And previously, obviously, for the retailers that did not sell, we gave them some signage they could hang up. We also recognized them publicly. But I think our relationship with our retailers has changed our involvement in the WINS program in recent years. So in the past, we would partner with the Milwaukee Police Department, who would then issue a citation. Retailers didn't have to pay it. They had the option of going through a retailer training that involved some of that education. But in the last 2 years, well, this year especially, we're kind of moving away from that model. So we're no longer, we're letting the police know that there have been buys, which is our law that we have to do for the program. But now we're looking at the retailers that do sell tobacco as an opportunity for us to go in and educate them and work with them so that this issue doesn't go away. So really our relationship with retailers, we don't want it to be a punitive one. We obviously don't want them to sell to minors. And if it becomes a problem, then, it's our problem as well. But we want to learn to work with them in a better way.
And just to add to that, with the WINS program, we certainly recognize those retailers who are doing the right thing and not selling to minors and not selling singles. And it was interesting, the retailers, they got to know some of our kids. We had to start switching up the kids because they recognized the kids as well. Some of them did. but they really enjoyed having conversations with our youth. They were sitting there trying to tell them, you're doing a good thing, and it's good that you're educating your peers. And yes, we had retailers that would say, it pains me when people come in and want to buy tobacco, young people and even older people. It pains me to have to sell them something that I know it's going to be harmful to them. So I would say that, yeah, we do the compliance checks, but we don't contract with the police department. Before, we were subcontracted out, and that entity subcontracted with the police and paid them overtime and this and that. And we just think we can do it a different way. So.
Cigarette retailers, or have you gotten engaged over vaping / e-cigarette products?
As Edgar mentioned, we're mainly on the north side of Milwaukee, which is predominantly, at the time, it was more the Swisher Sweets, the cigarillos, Black and Milds. It wasn't as much, e-cigarettes wasn't as popular. It has now started to become popular. So at the beginning, we weren't dealing with e-cigarettes as much. We're starting to see hookahs is also becoming an issue with kind of the college age or 19 and up age group. So yeah, now we are dealing with vaping as well. We didn't used to, but vaping is now, it's penetrated our communities as well, and we're dealing with that.
Retailers in which the owners don't work in the business. So I think of like CVS, Walgreens, those sort of places.
I was going to go a different direction. Before the pandemic, what we were trying to do is we were trying to do a study, and you saw Diane, she's at BP across the street. There's another gas station, and we wanted to do a controlled study in terms of trying to figure out how we can help retailers find a different revenue stream, not tobacco, maybe healthy foods, and because we're in a food desert, and the other one continue to sell the tobacco. So we wanted to work with retailers to see how can we get you to replace your tobacco products with something else. We know, so in terms of the large change, I was thinking about BP, because we know that these chains, they have grants that a lot of our retailers, they don't apply for. They're community grants that they give to retailers to say, use this money in your community to do good. So we were trying to work with the retailers to say, well, apply for a grant from BP to help offset the money that you'll lose by not selling tobacco, but use it for something else, something good for the community. So that's kind of, then it kind of got, we weren't able to continue in that course because of the pandemic. But we haven't worked with Walgreens, or, I mean, we do compliance checks with Walgreens, and Walgreens had problems checking IDs, and they were really having problems with IDs in terms of, because they have to run it through a scanner, but they were figuring out ways to still, allow minors to buy tobacco products. I'm not sure. I hope that answered the question.
Is takeaways be turned into a toolkit that can be used nationally.
Michael's smiling. Michael also does our graphics work. That's why he's smiling. We have worked on this for quite some time. We also have kind of a part 2 that deals with how do you operationalize this. We have a lot of components that we could pull together and put into a toolkit to help people, depending where they are on the continuum of retailer engagement. What are things that you can do? But at the bottom line is you got to start by having dialogue, open, honest, non-judgmental dialogue with your retailers, and figuring out how you can help them and how they can help you. So yes, we have the makings of a toolkit, right, Michael?
We do. I think there is just one or two more if we still have time. Let's see. Gregory asked if we can detail the role that the state tobacco use prevention plays in this intervention.
Good question. We just love the Wisconsin Tobacco Prevention and Control Program. They've done some very bold things. For them to put out a fact sheet talking about tobacco, COVID, and racism, that's major. And that went under their logo. And then for them, when people were running around at the beginning of the pandemic, they were trying to shut down some of our retailers, saying that they're not essential, they need to be closed. And I really kind of had a conversation to say, wait a second, they're not smoke shops, they also sell gas and other things. And can we also realize that there are small businesses that are getting ready to go through some hard times? I would just say the state has been amazing. They've been amazing partners. For them to agree to say, okay, you guys want to do fuel vouchers during the pandemic when the gas prices, you can use your funding that way. If you'd like to use your funding that way, they gave us permission to do that. They're huge supporters of No Menthol Sunday. We've had our Lieutenant Governor, our Secretary of Health. We've just had amazing support from the state. I mean, they're excited that we're sharing this information through the Center for Black Health and Equity. So I don't know, Edgar, did you want to add to that question?
I would just say what they've really done is really let us innovate and lead and utilize our grassroots model of engaging community and retailers and really support everything that we've done. There's been times where the state, starts shifting and there's other focus areas, and we've kind of gone to them and say, hey, we've already poured a few years into this. We need to keep on going. We're just starting to build momentum, and they've changed course and said, you know what, you're right, keep going.
Yeah.
Could briefly recap strategy number 2. We can repeat that strategy.
Yeah, definitely. So one of our best practices is tobacco retailer tours, and essentially the way we created these were talking to the retailers and asking them if they would be okay with us bringing a group of people into their store and allowing them to kind of showcase their store and even talk about tobacco prevention. So the way we did it, we would host meetings at our organization, and then after that meeting, or we'd leave time in the end of the meeting to have groups of people go to different stores in the neighborhood. They would already be signed up for these tours, and we'd literally walk down the street and go walk into one of our tobacco retailers at a scheduled time, and the retailer would be there ready to greet us. And obviously there was work ahead of time, but we would go into the stores, make sure that the retailers were good on their signage, make sure that they were following the best practices that tobacco retailers are supposed to find, such as not having tobacco near candy, things like that. And then we would just essentially just walk into those stores and let these retailers share their story. Sometimes the story would involve, oh, this is how I got into the business, but mainly it was the way to showcase that they were a partner of the community and they care about their customers' health, even though they do sell tobacco products.
You also look for tobacco industry signs and talk to the store owner if those signs are in the store.
I can answer that. We don't, because we don't know. Some of the retailers certainly have those contracts with their tobacco wholesalers that I mentioned, and the contracts are tricky to get out of. They promise them the things that they have to achieve in order to get those payments. So I mean, if there's Newports and signage hanging up, we don't talk to them about the signage. We just make sure that our signage is there as well. We have a T21 campaign that's going on, a state campaign, and we make sure they get that signage. I would say in terms of the retailer tours as well, that at the beginning, when we were doing compliance checks, we had retailers saying, well, we don't know what we're doing wrong. Just tell us what we're doing wrong. And we ended up helping them move their products. Like if they had products near gum and candy and toys, we physically helped them move those products. So part of it is just educating them that they didn't understand what they were doing wrong. But yeah, that's,
state. Again, wondering about ways this can be institutionalized / toolkitted so that it can be used nationally with community / city, state appropriate edits.
Edgar, you can go ahead and take that one.
Well, I think, you know, as the part of the question about how much success is related to the state, I mean, think it definitely supports us, but I think the real way that we found success is by just hitting the ground and engaging these retailers. I mean, they send me emails asking me to help them navigate the city website, things like that. I mean, it's just a genuine relationship where we can call them and ask them for a favor. If I call them tomorrow and say, hey, can we host a tour next week, Monday, they'd probably say yes. And that took, you know, years of kind of building that relationship and that trust.
And I just add one other thing. We do periodically check to make sure that they have not had any citations issued. So, I mean, we're really working with retailers that are doing the right thing. And if a citation has been issued, it's having a conversation, it's educating what happened. Was that a new clerk? Were they trained? That type of thing. But I would agree with Edgar. You have to have patience. This has taken a long time to build these relationships. And it started again with the singles, and it started with the community saying, we don't want singles and Lucy sold in our community. And we were just able to keep adding on. We added on No Menthol Sunday. We added on our T21 campaign. And then they started reaching out to us.
Someone from the center to let us know.
There's about 5 minutes left, so
Okay.
we probably take one more.
Okay. So let's see. Someone asked, has there been any pushback from the tobacco manufacturers or the retailers for No Menthol Sunday, or any efforts of the retailers? If so, how did they handle this? If we know of any pushback from the manufacturers to the retailers?
I don't know of any. I just know of a really very funny story that we were in one of the shops doing a tobacco tour, and the wholesaler was there. We didn't know. So we're in a predominantly Black community, and there was a white male in there. We had our state health officer with us, and we were there, and he was already in there doing his inspection about product placement. And he got really embarrassed and kind of tried to slip out the back door. So I think when they see that the community is behind something, they're certainly not going to confront them in front of other community members. But we haven't heard anything, right, Edgar? We haven't heard any pushback from our retailers.
No, and you know, there's been media behind it.
Yeah. So Michael's showing you our 6 kind of best practices.
Strategy. So I just wanted to put those back up on the screen, and also want to let people know that there's 2 places that you can go if you're looking for more national information. The tools that the Center for Black Health and Equity has, you can go to nomentholsunday.org. If you want some of the things that we developed for No Menthol Sunday, like the retailer posters, we have lawn signs that you can print out, palm cards that you can print out. You can go to nomentholsundaywi.com. On there, we have our toolkit. It's a Google Drive folder that'll allow you to download the PDFs of everything that we created. So you're welcome to use those, download those, and get those printed. Okay.
So again, I just like to thank the center for having us, and the center for supporting this work that we've been doing with our retailers as well. So you asked about the state program, but the center also has certainly supported our efforts. So we thank you for that.
Lorraine, we've got about 4 minutes left.
Mhm.
One of the questions that came up was about the mini grants. Did you have a range for mini grants when you provided for the retailers? And I know they sell tobacco products. How did you get around the idea that we should not be giving money to those who are selling menthol tobacco products?
So our mini grants were for $500, and they weren't just for retailers. They were for others that in the community, other organizations that wanted No Menthol Sunday to be extended beyond May. So it happened in June. How did we get beyond that? Because it was the retail, in terms of giving money to organizations that sell tobacco products, we got beyond that because it were these same retailers that were coming to us saying, wait a second, we've been putting this sign up saying we're observing No Menthol Sunday and we're not selling menthols. We want to do more. We want to educate our customers so that they can be customers for life and not end up dying from cancer. And that's how we ended up developing the palm cards that refer them to 1-800-QUIT-NOW and other resources to help with smoking cessation. That's why we've developed new palm cards that are dealing with vaping as well. So it was the retailers that were asking us to help support them. They wanted to continue and give information back to the community. So to us, it was a no-brainer. And again, we had the support of the state. We were clear with them. We're going to fund this entity, a retailer, $500 to do a community event.
Mhm. Well, let me just say thank you for your expertise. I think this was very enlightening because also this actually provides us an opportunity, and I hope for others, an opportunity to reach out to those non-traditional partners, knowing that they are wanting to be engaged, they want to move forward, they want to help us with this product, our product. And actually, you provided an opportunity for your folks in your community to be ahead of the curve so that when the FDA makes their ruling, their final ruling, and they get rid of menthol as a characterizing flavor, then your community is already ahead of the curve. One last question is that someone asked was, do you only do No Menthol Sunday once a year? I know for the national, we do it once a year. But
We only do it once a year, and then our other campaigns are T21 campaigns, which we actually had retailers help design that campaign. It's a state campaign, and then No Singles, No Loosies. But we only do No Menthols once a year, although we had some retailers were thinking that menthols had already been banned in Milwaukee. So yeah, just once a year.
Keep it going. So thank you. I'd like to say thank you to our presenters. Thank you to all of the participants. It was an exciting time. We look forward to you engaging your retailers at your local communities. We hope that this was enlightening and that you will be able to move forward. Again, remember to go to nomentholsunday.org and nomentholsundaywi.com for additional materials that you can download, that you can print out, that you can utilize in engaging your local retailers and your local communities beyond the faith communities. So get your faith community involved with them. Remember those walking tours.
Whoops, he's frozen.
Looks like Greg froze. So Lorraine and Michael, can you give your website one more time? Because I don't think we were able to put it in the chat. Your the center's No Menthol Sunday website is nomentholsunday.org, but Wisconsin has their own site.
It's the same as yours, but WI. So nomentholsundaywi.com. nomentholsundaywi.com.
Well, it is 4 o'clock. Thank you all for joining us. We will have a recording of this online, and we will send a follow-up message to all of the participants with some of the information that you requested. So definitely expect to hear from us again. Thank you very much for joining. Have a good day.
Thank you.